Now, can you tell us how using the device helps singers,
Yeah.
artists,
Yeah.
actors, those who goes on the stage?
For the singers, the DVT program and the devices help them to correct registration, to develop the proper registers, the chest register, falsetto, passaggio, the head voice, and so on. It helps to reach to the physiological borders of the vocal range. I mean, you cannot sing high pitches. You can do it. Because singing has two parts. One of them is the artistic part, which is perfectly done with singing teachers. But the sportive part of the singing process, it's a stuff. And if you want to deal with the sportive part, you must deal with muscles. In sports medicine, to develop a muscle, what do you use? You use some dumbbells, right? Dumbbells, you heavy things too. How can we use a heavy thing for our vocal folds? So it's what we call back pressure or semi-occluded vocal tract exercises. Now I want you to say, no, bubbling. From the beginning, it should bubble. No, it's not bubbling. Again. Again, please. This is better. When you go the lower pitch, I want you to enlarge your throat to the back. Okay? Don't push it down. No. It's something like that. This is better. You can use it. So in order to develop muscles, you need overload. If you want to continue to develop, you must increase the overload, and we call it progression. And if you want to keep it, it's adaptation. The muscles adapt to the new power. So you can sing high pitches, you can sing lower pitches, you can sing longer, you do not get tired, and you can warm up your voice, you can cool down your voice, and you can prepare yourself for the stage, just before the stage, and for the tour. If you are going to get into a tour, you can keep yourself fit, vocally fit. So we call it vocal fitness. So these are the areas that you can use in pedagogical vocology.
Anyway, thank you very much, Dr. Vita.